Yeah, there's a trend, of course, or we are trying to treat these patients with oligometastasis in as few fractions as possible. So, if it is possible with less, often with less treatment fractions, then it is, of course, preferable for the patient. And as this treatment is very tolerable and has a very low toxicity profile, this is very frequently possible, and this goes down to a single session where the whole dose can be given in one session, which is, of course, very attractive because you come in as an outpatient, go to the treatment room. Of course, after some preparatory work, we have to do scans before and to plan the treatment. But then the treatment itself is only a single session taking about half an hour or 3/4 of an hour. Of course, this is high precision treatment. It requires quite some technology, starting with the planning scan that can either be a CT scan, which is the typical modality to base the treatment on, but it can also be MR scans or PET scans. And then, of course, the treatment has to be planned. And then at the treatment, you can imagine if you have only 1 or 2 or 3 fractions delivered, they really have to be very exact, so that so if you miss the target and have only 1 session, then it's a real miss. If it's 1 in 35 fractions, that's not so dramatic. So so the progress is in the technology in this respect, both on the planning side and also on, of course, computer power to make even better plans. And at the treatment delivery, the treatment image guidance on the treatment machine using CT or MR, and the treatment machines themselves.